Hey guys, welcome to the Instagram live today. We have a very special guest with us.
Hey.
And we actually just did a PRP joint injection, and we figured it would be a good opportunity to talk about joint injections in general in this live, plus obviously answer any questions you guys might have for us. Today we were doing a PRP joint injection. And you want to kind of introduce yourself?
So hi guys, my name is Lauren Sesselman, and I'm a professional soccer player, and I tore my ACL in 2014, and it was a bad injury, and now I'm bone on bone. I don't have any cartilage in my knee. So what's been great about getting the PRP injections is it really has helped lubricating my joints, and it's really helped with the swelling, the inflammation in my knee, and I'm able to go about my business day in and day out and still play soccer. So I've been very fortunate to be able to come and work with Doc here and to get an injection today, and I'm looking forward to feeling a lot better.
Thank you. And Lauren, you've had an injection about maybe 3 or 4 years ago with PRP?
Yeah, I've done it once before, and I had a lot of success with it. And so, yeah, I'm going into my season now, and I wanted to get another one to kind of, start off and get ready for the season. So
perfect, yeah. And that's a great thing about the PRP is that it really helps rejuvenate the tissue in there. So there's a lot of uses for it, but a lot of people who have knee pain, whether we do see a lot of athletes just like Lauren, but we also have just regular people too who've been with time, or they've had a specific injury and then they're having issues with their knees causing them pain, or whether it's pain with activity or pain at rest. Sometimes you have to do surgery for certain knee issues, but sometimes before surgeries, if you've tried kind of the regular medications like ibuprofen and Tylenol, and they haven't helped, or even if they help, but you're looking for something kind of more long-term, or something that's not just covering the problem, but actually helping resolve some of the problems, PRP might be a good option for you, again, depending on exactly what's going on with that knee. And the way it works is we start with taking the patient's blood, and then what we do is we concentrate the platelet-rich plasma, which is what PRP stands for, platelet-rich plasma, and we inject, that PRP back in the knee for the platelets to get activated. And once the platelets are activated, they basically release a lot of growth factors and cytokines in the area. And the cytokines are basically the way cells communicate with each other. So the platelet-rich plasma kind of gets activated, is injected in the knee, and it releases these growth factors, these cytokines, calls other stem cells to the area, and it kind of starts the healing process, or kind of activate the healing process. So it works with people who are having issues with their ligament. The knee joint, and any joint in general, is it's a complicated body part. It has, you have ligaments, you have tendons, you have the meniscus between the knees. And with wear and tear, with activity, and just in time, some of that tissue can get weaker. Little accidents can accumulate and cause like micro tears in these ligaments and in these tendons. And obviously, if someone's more active, like Lauren, who have that's why we see a lot more professional athletes do, or if someone's been cycling for a lot or something, they can sometimes speed up that damage or that process. And we've been seeing great results with PRP once it's for the candidate. Obviously not everybody's going to be perfect for PRP, but for most people it's not going to hurt to at least get a consultation and see if the PRP would be a good option for them, because for those people who PRP is a good option, it can really alleviate a lot of pain and really help reverse some of that damage that's been accumulating over time. It will be just like every Instagram live, taking your guys' questions. So if you guys have any questions, make sure to ask us. Otherwise, we'll just talk a little bit more about it and explain the different systems that are there, because not every PRP is created equal in a sense. PRP stands for platelet-rich plasma, and so when we start the process, we take the patient's blood, and then we want to concentrate the platelets. And word PRP is in some ways not specific because it just says it's platelet rich, but how platelet rich the plasma is makes a huge difference. So there are kind of different there are different systems, for example, out there to concentrate the platelets, and it's important to kind of know what system you're getting and what kind of treatment you are getting, because you can sometimes get like cheaper version of the PRP where you're only getting like 1.5 times the concentration or 2 times the concentration of the PRP, and that might not be as beneficial. It might not be as beneficial to the joint, for example, as when you do a 6, 7, or 8 times the concentration. So these things might be like a lot of people wouldn't know. They would just feel that they're getting PRP and they think that they're getting the high quality PRP. But if you are doing the injection yourself, it is important to ask questions to kind of see if the kind of PRP you're getting is actually a high quality PRP, which with a high level of concentration of platelets, because again it can be done in a kind of cheaper way to save money and save time, but then you're not going to get the same quality. We do use Apex here, which is one of the kind of leaders when it comes to PRP injections in general, and we're able to get that 7, 8, 9 times the concentration of platelets using that system. But again, that's because a lot of times people come in and they're like, well, I've done a PRP treatment, but it didn't work, but I wasn't sure, and I went that other place because it was like cheaper, and a lot of times when we kind of try to see the type of PRP they're doing, we see that it's really not good quality PRP, which might be a waste of time and money. So
are you experiencing, this is I think directed towards Lauren, are you experiencing any pain? How was the procedure itself?
So beforehand coming in, my knee over wear and tear, I lost a lot of cartilage, so anytime I would work out, my knee would swell up and I would have to not work out for a couple of days. And so getting the PRP is supposed to help alleviate that pain and making sure that I'm not swelling up as much. So the process itself is very painless. I mean, I think the only thing is you feel it obviously when the knee is going there, and I don't have any cartilage, so I felt it a little bit more because it was more of the bone on bone. But it's just a little prick. If you've gotten shot before, that's basically the pain level of it. It's not a bad thing at all. And your knee feels a little bit tight afterwards, but right now it's coming back down and it feels absolutely normal. I'm gonna be able to walk around. What I love about this is the recovery time is I don't work out for a couple weeks, not a couple days, not a couple weeks, a couple days, just to kind of let it settle and just to kind of let it rejuvenate and lubricate those joints, and then I can slowly start getting back into it. So I start preseason in 2 weeks. This is a perfect time to get it. So I'll just go for walks the next couple of days and just kind of let the PRP do its magic, and then I can go back to my everyday activities. I was having issues going downstairs, climbing up hills and stuff like that. So as I said, my knee would just swell up. So this has been a huge blessing to get a PRP treatment.
Yeah, and that's great description of the process and how it goes, and really, as Lauren was saying, there isn't a lot of downtime. I mean, sometimes it might feel like a little bit swollen for a couple of days, so we just ask you to take it easy for a few days. But other than that, you can go on your daily activities as normal, just kind of avoiding excessive activities or
lifting or anything like that. I don't
Exactly.
squat or lift or anything like that. I just go for walks and chill out for a few days.
Exactly. So just kind of taking it easy, but it's not like you have to be laying in bed for a week or anything like that, where you can't get out of bed, or you can just take it easy for a few days and you'll be fine. And then a lot of people start seeing results within a week or two. That's kind of the more kind of optimistic range, but it can take a few weeks to really start seeing results. It can take up to 7 or 8 months from the day of the treatment to kind of see the full effects of it. but that doesn't obviously mean that you have to wait like 7 or 8 months to see the results. Usually what we'd say is most people within a few weeks, they start noticing a little bit of improvement, and then a month later, it's improved even more, and then a month later, it's even more. And, some people, I think with Lauren, she's going to experience the improvement faster just because she's a little bit more active and kind of her knees used to it. So I expect within a few weeks, she's going to notice a good difference, and then within a couple of months, she's going to notice a really big difference. But some people it might take a little bit longer. But again, it's because we are we're trying to get these tendons and ligaments and meniscus to heal, and these things can take some time to rebuild. They're not they have a little bit of a slower turnaround. But yeah, you just kind of get a little bit of pain or swelling for a couple of days. Sometimes some people don't even get that, but then after that, it kind of goes back to normal, and then within a couple of weeks, you start noticing the improvement. It keeps getting better and better over the period of the next few months.
Somebody's asking what other joints would benefit from PRP injections.
You can honestly do pretty much any joint. Now, there are joints that we do much more often. Mainly the knee is probably the common one, but also shoulders and elbows are very commonly done. It does get a little bit more tricky once you get into smaller joints, because the joint itself is a space. So when we do like smaller joints, like around the hands and stuff, you can only put so much fluid and so much PRP in there. It can be done in other. So by far the most commonly done are gonna be knee, hips, elbows, and shoulders. These 4 we do all the time. Other joints it can be done in, but it's a little bit more tricky in there. So, but these 4 joints are like 95% of the time it's gonna be one of these 3 joints too.
All right. I think we have one more question. Do these help with chronic maltracking, PF pain, and inflammation? Sure.
Yeah, so they do. It's gonna vary from person to person, but usually that kind of stuff, like kind of more chronic things that been going on for a while, they tend to help a lot more. Sometimes we do it for acute injuries too, meaning someone had specific injury, specific fall, and they kind of tore a ligament. But in those cases, we usually get an MRI to kind of see the degree of the tear. But the kind of more chronic issues, the kind of more wear and tear stuff, as we're talking about, and even inflammatory diseases. Okay. Even inflammatory diseases, these PRP can be very helpful for.
Awesome. I think that's it. I don't know if Lauren, you wanted to add anything or just.
No, I think as an athlete, I've pretty much tried everything under the sun to help with my joints, and I've had the most success with PRP. As somebody who's extremely active like me, I'd probably get a shot every 8 or 9 months. Everyone's different. Sometimes I get 2 as well, so I'll wait a week and then get another one. And so it just depends on you as a person and how much activity you do. But every time I've done it, I've had so much success, and my parents have done it and they've had success as well. So if you're interested in it, I think you guys should definitely try it out and see if it works for you, because don't do cortisone, don't do any of those things. Those are so bad for you. But PRP has been great for me. So
yeah, no, I appreciate that. She is more active, which is why she might have to have it like a little bit more often than most people, because she is kind of she's professional soccer player, so she's always putting a little bit more stress on the knee than most other people. But yeah, I'm glad to hear that you're having great results with it, and it's definitely one of my kind of favorite procedures to do here, because we do keep hearing kind of that positive experience from patients, and it just makes us feel good to hear that kind of positive feedback about that about this treatment in general.
Cool. Well, that's it. But yeah, thank you so much, Lauren. Thanks, doctor, and yeah.
Thank you guys for your questions.
Yeah, thank you for joining us. Have a good one. Bye.